let's take you through the COVID figures coming just in of the latest we have in the past 24 hours. 97,570 new cases reported in just one day. Now, this is a new record being set in India. Nearly 1 lakh cases a day is what we almost have in the country now, 3 times higher than the United States. At the current rate, India is likely to overtake the US earlier than expected, probably in the first few days of October itself. The number of deaths remain to be around 1,200 in just one day. Akshay Dongre from Delhi and Sohit from Mumbai, both joining us this morning. Akshay, first to you. At this rate, India, forget flattening the curve, has not even reached its peak, if it's going to be a new peak almost every day. At this point, what exactly are the measures that you're hearing from the Health Ministry? Any revision of guidelines? Because when we spoke with the health experts just a minute ago, they said that at this point, it's to each his own. It's the people and the citizens who will have to take control of their exposure at this point and beware of the virus.
Well, clearly, Sonal, as far as, like you have mentioned, that forget about flattening the curve or bending the curve, we haven't reached the peak yet. And we all remember that how when we saw initial number of cases in India, there were several health experts who were saying that the peak will be achieved by the mid of July. Some were saying that by the end of June. And at that point of time, it, sounded very scary that we have such a long period of pandemic ahead of us. But the sheer unpredictability has, crossed all the limits, because even right now in the month of September, we are seeing continuous number of cases. Let's remember that it took India 64 days to cross the 1 lakh figure, but now we are achieving that in a single day. No other country has ever recorded so many cases of COVID-19. Also, the first Sero survey that, the national Sero survey that was conducted by the ICMR has cleared a lot of doubts that we had regarding the rural India. And it clearly said that in several districts which had 0 cases in the Sero survey, it became clear that even those districts had cases. And the reason that no cases were being reported from those areas were because no testings were being conducted. Inadequate health infrastructure was the reason behind, false information that rural India is not as much affected. Those were the initial days. The situation is becoming scarier. The health ministry is now saying that the people will have to take, control of the situation. They will have to adhere by the norms. They will have to take all the precautions. But that is something that everyone has been doing from the very beginning. The bigger question will be what exactly is the government planning to do about the rising number of cases? How they plan to enhance the health infrastructure in the rural parts of the country, especially in the areas which are, inaccessible, which are very, very remote. And that will be the biggest, scare for the country, because we can hear news about Delhi, Mumbai, major cities, but what exactly is happening in the small rural areas, that is the biggest worry.